Welcome back to Little Faith. This is a podcast sponsored by the Williamsburg Christadelphian Foundation. A Little Faith podcast explores both the challenges and hope of living a life of faith. This is our second special podcast covering faith during COVID-19. Today, Matt interviews Imogen Jones, a junior doctor from the UK who specialises in infectious disease and microbiology. Imogen is serving in the Frontline and gives a unique perspective on how the situation is developing. She also reflects on her own faith during this time and how we all as a community must work together.
Hello, nice to finally meet you over digital video realm. So whereabouts are you located?
So I'm living in London at the moment, so down in South London, quite a nice area. We've been sort of self-isolating, so I've actually had some symptoms over the weekend that could be consistent with coronavirus. I think it's probably not. I think it's probably a cold that my small child gave to me. But hopefully I might be able to get tested on Monday, because otherwise I won't be able to go back to work. So I'll know one way or the other, but I'd be very surprised if it is, because it's not been very severe at all. And from what I understand, most people have had pretty severe symptoms. So I feel a bit like it's been quite sunny here over the weekend, but unfortunately I haven't been able to go out and enjoy it that much. But yeah.
Yeah, I think that's a quite a common phenomenon for people, is there's like a lot of different things going around, and any sight of a sniffle or a runny nose or like a weird tickle in the back of your throat, you immediately are starting to, the anxiety levels are starting to rise and you start to freak out a little bit.
Yeah. No, it's difficult not to read a lot into any tiny symptom at the moment.
Yeah, and then so I'm in Canada, and I've got two roommates here, and we have essentially been self-isolating the last 10-ish days.
Yep. Okay.
I don't know. The days are kind of bleeding together. I've lost count of how many days that we've been cooped up.
So, and is that what I have completely lost touch of what's happening in Canada at the moment. Is that what the government have recommended everyone, like you're kind of on lockdown there as well?
Essentially, they haven't said any formal language around locking down, but most of the services are closed, with the exception of grocery stores and pharmacies and such. Yeah. What about the UK?
Yeah, well, they gave sort of pretty explicit instructions the other day, like do not go out unless you're allowed like one exercise a day. I think it is and they say a run or a cycle or a walk. Otherwise, you can go like to get shopping, but that's pretty much it. So police are. It's a bit bizarre. Like police are releasing drone footage of people walking in the countryside and being like, they shouldn't be here, and it's like, well, look, there isn't anybody else around, they're not really doing any harm, like they're not near people. The whole point is it's meant to be like distancing yourself, so it's a bit bizarre. But yeah, people, I think in towns and cities, police are kind of stopping people and being like, what are you doing, why are you out, and things. So yeah, no, it's definitely got a bit more draconian here, and they definitely, I think they realised that otherwise just the number of cases that were going to sort of simultaneously hit hospitals and intensive care units were going to be completely unmanageable. So I think that's the reason that they've done it, and hopefully it'll work. But yeah, I think mainly people are sort of abiding by it and stuff. So yeah, hopefully it has the desired effect.
So you have an interesting perspective on this whole situation.
Potentially, yes. Yeah.
So you're a medical doctor with I'm probably gonna get the title right, but a focus in infectious diseases.
That's correct. Yeah. So I'm currently sort of nearing the end of a training program, which I've been on or in and out of since 2014, which is in infectious diseases and microbiology. So some of the time I'm based more doing sort of lab side things, which is sort of the liaison between the laboratory and the clinicians. And then at other times I'm doing sort of clinical work, either outpatient clinics or inpatients. And so I just came back from maternity leave at the beginning of February to a job on an inpatient ward at a sort of major teaching hospital in London, just as we were beginning to... Well, I mean, at the time, obviously there had been reports since January, and we were starting to do some community testing for people that were coming back from, mainly at that point, I think, coming back from Wuhan region in China. So yeah, it's been quite interesting, the change that's happened since I came back to work.
Yeah, so you basically like cannonballed into the pandemic, into the medical field of working with people who were affected by this virus.
Yeah. Yeah, so at first we were seeing a lot of the, as I say, we were doing community testing, so we were seeing, and the kind of geographical areas gradually opened up. So at first it was just kind of Wuhan province, and then sort of China more widely, and then in the UK they opened it up to sort of more areas in Southeast Asia, and then obviously Italy and Iran were the other places that we were testing for. And over those weeks, it became evident that there were people that had travelled back from, say, Washington that had very suggestive symptoms, and we had this sort of fairly narrow case definition of places that people had travelled to that we were trying to test for. And so at the beginning, we were mainly seeing people that didn't have coronavirus who were worried because they'd been to an area where there was coronavirus. And as that went on, it became more evident that we were talking to people who probably did have it, but that didn't meet the testing criteria, unfortunately, at that time. And then a few weeks ago, that was abandoned, and they decided just to test people that were ill enough to need hospital admission. And now, it's gone sort of further. So now most of the people that we're seeing coming in the doors with respiratory symptoms are coronavirus positive. We still are getting people that have got bacterial pneumonia and things like that, and it's kind of that we're trying not to miss any of those people with the diseases that we would have been seeing that are our normal sort of bread and butter and what we would have been seeing before the coronavirus. And you're sort of trying to keep your head sort of not lose sight of things so much that you don't that you miss stuff that you would have normally seen as well. So it's quite difficult to sort of keep the balance of accepting that pretty much everyone's got coronavirus, but also not missing things that could in other circumstances kill people, and make sure that those things are also treatable, and giving appropriate antibiotics and things.
Yeah, I mean, it sounds like there's such a gravity around the coronavirus right now, and I mean, it sounds like a medical perspective, you are trying to keep that in mind and trying to like bring these other really important, pressing cases to your attention and still focus on those while dealing with this rapidly evolving circumstance.
Yeah, exactly. And I mean, and also because there's so much of it around, and especially in hospitals, we have definitely seen transmission within the hospital wards as well as people coming in with the virus. There's nothing to say that people can't have both things, whatever the underlying problem is, but also they've got coronavirus, which adds sort of levels of complexity in terms of trying to manage them or getting a scan for them, and that kind of thing. So it's it's definitely been a challenge.
So you've kind of already been addressing this question, but I'm curious if you could walk us through a day in your life right now. You've been back from maternity leave for like a month. Obviously, from what you've been talking about so far, things are changing day to day and week to week. But for those of us who haven't left the apartment in 2 weeks, such as myself, like in my own head, I'm like fantasizing about what the hospital and what is going on in doctors' offices and white coats, and all of it is kind of this dark idea. So maybe you can provide some kind of boots on the ground perspective on that, of what it's like for you day to day.
Yeah, I mean, as you say, everything has changed a lot in the last few weeks, and so we've been through several different sort of team structures and things. But so what we, in terms of where we are at the moment, we're kind of in an interim stage at the moment between two rotas. So our old rota, where we would have had probably 6 or 7 doctors of a kind of junior, so I'm a junior doctor, so we'd have 6 or 7 doctors in 2 teams and 2 consultants heading those teams, and we were sort of generally there 9 to 5. Nobody was doing a resident night shift because there was other doctors in the hospital that could look after the patients, but then 2 doctors over the weekend with a consultant, to now having this rota where we've got sort of potentially 6 doctors on every weekend. We've got 2 or 4 doctors on every night shift and a number of other doctors during the day. And so so the work structure has changed massively, and we've pulled in all sorts of doctors, from people doing PhDs, people potentially people like me who when I came back from maternity leave had gone back 4 days a week and doing 50% on calls, have increased my hours, so I'm doing sort of 100% on calls, 100% like full-time hours. So they've kind of from everywhere they've pulled in extra doctors to staff this rota. And one of the things that I think has been really amazing about the response so far is the sort of teamwork and things, and the fact that they recognise that this is new for everybody, that we're learning new things each day and how to disseminate that learning. So now We're having team meetings every morning at 8:30. So we will talk about any kind of teething problems as we've set up the hospital where I work. 2 weeks ago, maybe, as you say, all the time kind of blurs, but 2 weeks ago we maybe blocked off half a ward for coronavirus patients, which rapidly filled up. As of last week, they opened a whole new ward below that, so that's probably sort of between 30 and 40 beds. And then I think this week coming there's going to be maybe another 2 wards of up to sort of 40 beds each opening. So they're kind of rapidly expanding the amount of area in the hospital that's looking after the coronavirus patients. But they are saying, are kind of the learning lab. So we're the people who've been doing this from the off, and we're going to have to rapidly hand over to other medical specialties. But we're kind of taking the learning that we've had from the last couple of weeks and handing that on to other teams. So that sort of, we have an 8:30 morning meeting where night shift will report from they will hand over about sick patients from overnight, and we'll iron out any kind of teething problems. In the majority of that, as that has now been done in the last 2 weeks. So things like at the beginning, like the phlebotomists who normally take the blood didn't want to come on the coronavirus ward, but it wasn't sustainable to have the doctors going around every day taking blood from all of the patients. And so it's just kind of making sure that they've got the training that they need to feel safe when they're on the ward, so that they can use their personal protective equipment appropriately. So it's kind of issues like that you just, like, there's a solution to it, and most of the time the solution is probably training, but sort of ironing out issues. And then we split into, I guess, 3 teams. So people who are looking after the positive patients who we've got a result on, people who are looking after the patients that have come in that we're waiting for a result on but we're highly suspicious have got coronavirus, and then people who are doing outreach into the rest of the hospital to support those areas that have potentially got positive patients but are less familiar with managing them. So that's how our team structure is at the moment, and we're kind of rotating on and off those teams. Last week I was on the team looking after those who were waiting for a test result. So people that have come in with a very suggestive history but haven't yet got a positive diagnosis. And I was on over the weekend, and that was a mixture of sort of looking after the positive patients and sort of troubleshooting around the rest of the hospital. Everybody, one of the big things at the moment is that this is a new disease to us. We don't know necessarily how it behaves. We're doing our best to read the literature that's come out of China and now sort of Italy about how can you recognise a deteriorating patient, what pattern of blood test tells you that somebody's likely to get sick, what are the kind of parameters that you should be looking for, and when we do know that people tend to deteriorate around sort of day 10 if they're not already better. So the majority of people will probably be better from their illness by then, but if they're not better, then potentially it's around day 10 when they're going to get very sick and need sort of additional support. So it's sort of trying to figure out if you've got somebody who isn't on oxygen but they've got worrying blood tests, maybe you don't send that patient home because you don't know that by the next day they might need oxygen and they might be in intensive care. But equally, we've got that luxury at the moment because we have enough beds in the hospital, whereas we know that in a couple of weeks' time we may have to send people home and just sort of safety net and say come back if you get worse, because we won't have the space to keep them in just to monitor them. We're trying to learn and adapt with regards to that. Then another meeting, one of the consultants last week said, look, we need to have a sort of meeting where we meet once a day in the middle of the day so that we can discuss some of these issues, around individual patients and things, particularly with things like diagnostics as well, because the test isn't foolproof. We know that some people, the swab comes back negative, even though, we're highly suspicious that they've got the disease. And what do we do? Do we do another X-ray? Do we do a CT scan? And then there's the attendant sort of issues about getting them down to a scanner safely and making sure that other people that then go in the scanner after them aren't at risk of catching the virus and things like this. So a lot of it is sitting down and talking to people and learning and trying to come up with a sensible plan in addition to the sort of the general patient care. There's just a lot of sort of talking and learning involved at the moment.
Yeah, and what stuck out to me while you were talking was the immense complexity as well as the hyper connectivity. Like, it really sounds that although there is some unknown and what we're dealing with is something that's very complex, there's an adaptivity and a responsiveness with you and the people who you're working with to move with this issue as it's unfolding. And I feel much more assured, like just listening to you talk about all of these troubleshooting routes. And when this problem arises, we do this. And if this is the case, we move this person to this floor, and we make sure that this person gets this. And phlebotomists, Like, I'm very, I can't imagine being in your brain right now. Is it easy for you to shut this off? I mean, you are on the front lines.
Yeah, no, it's not easy to shut it off at all. You sort of, I mean, yeah, as you can imagine, there's lots of WhatsApp groups. There's like everybody's putting stuff on Twitter. You know, there's new evidence emerging as well all the time. So, you know, different journals are publishing sort of rapid updates about things. So you're sort of trying to keep on top of things. And also, like, everything changes so I have now not been at work for 4 days. I think I was last there on Wednesday, and then because I worked last weekend, they said, we're well staffed, have a couple of days off, and then I didn't have to work this weekend. But everything will have changed by the time I go back on Monday. So you're aware that, you know, how you left it is not how you're going to be going back to it if you have more than 2 or 3 days off. And so you're trying to not be completely out of the loop. So I've had colleagues who have unfortunately or most likely had the coronavirus, who've had about a week off, and they're sort of ringing and saying like, well, this is how it was when I left, but actually, you know, can you tell me what's happening now? Because, you know, you just feel completely out of the loop if you have more than a few days off. And so, yeah, it's definitely hard to switch off. And because it's constantly on the news, you know, as well, you're getting Guardian is pushing notifications to my phone about Boris Johnson having got the coronavirus yesterday, etc., etc. So yeah, it's quite hard to switch off from it. But yeah.
So you put yourself so you have a husband and a young daughter, and you, with the nature of your work, put yourself in a very at-risk environment of possibly contracting COVID. At least in my head, that's where you put yourself, being in this clinical setting. So what's that like for you, with having a home full of people that you love and trying to keep yourself and your family well, but still trying to do the amazing work that you are doing?
Is it definitely sort of is something that you think about. I think partly at work almost you feel more in control, because like in general, you know who's got the disease or who's likely to have the disease. You've got the personal protective equipment that you need. There is a lot of debate in the moment in the UK about whether what we're using meets sort of the WHO definitions and things like that. So there's a lot of anxiety about it, but I genuinely trust that it does protect me, and so almost it's easier when I'm at work, because I know that when I'm going into a room of a positive patient, then I can put the mask on, I can put the gown on and the gloves and things. As long as I'm very careful when I take that off, then I should not be at much more risk than I would be when I'm out and about. And I think it's interesting, again, talking of not being able to switch off, I've seen some debate on Twitter this weekend about, I think there was a Dutch group that sequenced the viruses of healthcare workers and showed that it wasn't that there was sort of healthcare worker clusters, you know, so that these people were likely acquiring the virus in the community as much as they were in hospital. So almost, the time that I've been the most nervous last week was like when I got the tube last weekend, thinking it'd be fairly quiet on a Sunday morning, and then mainly because of a lot of staff sickness of the tube workers, the train didn't go for 15 minutes and people were sort of getting into the carriage and coming and sitting next to you, and you're kind of thinking like, I really need to go to work and just not be sick. And so then I've sort of made a decision from now on, I'm definitely gonna be cycling to and from work. If I'd cycled the day before but had left my bike at work, and then so I sort of regretted that decision and have been cycling since. But so I think at the moment you can get it anywhere when you're out and about, and almost I'm sure that hospital lifts and things like that, maybe somewhere where you're more at risk, but I think in general the risks are controlled at work, and so that hasn't sort of worried me too much, because hopefully I can minimise the risks by following the sort of protection that they've given us. Having said that, I know all of the things like about touching your face and that kind of thing, I'm not very good at that, so yeah, I know exactly, just all the time. So I know that there's if I'm not careful, then there's every risk that I could sort of give it to myself. But yeah, so trying to sort of keep level-headed about it. It's difficult when you see young patients who are sick, who haven't got any sort of other medical issues, who are going to intensive care and things like that, and sort of thinking, well, there isn't really any reason that couldn't be me in a couple of weeks' time, and you just have to hope and pray that isn't you. And I guess I haven't got a will. I've thought, should I have got one? Should I have sorted out life insurance before this? I guess it does it's something that you think about, but then you kind of just I think, well, there's also no reason that I wouldn't just get a mild illness like the majority of people who get this. So you just kind of try to keep level-headed about it, really.
Yeah, and I think you brought up some fears and angst that a lot of people are having right now. Especially, you cited the example of seeing the young person who had no pre-existing conditions being wheeled off into the ICU, and thinking, hey, that could be me. So holding kind of the currents of fear that are going around and that we might feel very personally, and the anxiety that comes along with that, how does faith align with this or balance with this? Or how has your faith been on a journey throughout the last month?
I would say I've not had I'd say that my faith has sort of remained pretty strong throughout this at the moment, and it definitely brings me some, I guess, kind of comfort is not quite the right word. Maybe it will come from me. Sort of when I go into work, I guess I know that there's some strength that I can draw on from God, from sort of praying before I go onto a shift, that he will be with me and will help me to do the best job that I can for my patients. You kind of know that you're going into uncertainty, and I think that's when, is where you need faith, isn't it? Like, it's, being sure of what you hope for and certain things that you don't see. So there is a lot of uncertainty at the moment at work, so having a faith helps to deal with that uncertainty, I guess is what I'm saying. And you hope that things will work out as best as possible for the most amount of people, but that it can't, that life isn't fair and it can't always work out as best as it can for everybody. I guess some of the things that have been difficult have been seeing people who haven't been able to have their relatives as close by as they would have liked potentially when they're dying. So that's been one of the areas that's can be more affecting. At our hospital, we have made the decision that if somebody's dying, then they should have relatives there with them. And again, we will support the relatives in putting on the personal protective equipment, and so that they, so that they can have somebody there. And I think that's a good thing to do. But I know that isn't the case at every hospital, and it's just generally affecting people having support there for them in hospital. So it is making your day-to-day job harder, I guess. I've got slightly off topic, I think. But,
no, I'm following you. And so, when you pray before your shift, for example, like you just mentioned, is that more of a personal sustain for you, or are there other elements of that? I guess I'm asking, like, I'm trying to sense how individual and personal prayer. And that's just one example that you gave, but faith specifically is, and like how broad do you cast that to the people around you, either just in prayer or in conversation and interaction?
I would say definitely for me it's more of a personal thing, and I do pray sort of for my colleagues and the wider effort as well. But I wouldn't necessarily have conversations with people at work about it at the moment, because I know that there's quite a sort of divergence of views, and you don't want to wind people up too much. Yeah, no, I haven't had a lot of conversations at work about it, which is maybe something that I should change. I guess, I have some colleagues who I work with at the moment at the hospital, but I've also lived with in the past in Sierra Leone. I did some work there a couple of years ago, and so one of my housemates from there, and so she knows me incredibly well, and so people that sort of know me well know about my faith and know what it means to me, but a lot of my colleagues at the moment I don't know that well, so they wouldn't necessarily know that it's something that's a big part of my life.
Yeah, and I was actually hoping to ask you about some of your more international work. I think Helen had mentioned Sierra Leone, Malawi, maybe?
That's right, yeah.
And maybe one other place?
I went to Tanzania when I was a student on my elective, so yeah, that was the first time that I travelled.
When you were living abroad or working abroad, you had some contact, or you were doing some work with some other pretty serious virus viruses or diseases? Like, I think maybe Ebola.
I went to Sierra Leone actually after the Ebola outbreak had ended. So I did volunteer to go during the outbreak, but by the time my work was able to release me, they didn't need international help, which was good. But so I went and spent 18 months there from August 2016 to February 2018. So we would occasionally see people that we would test for Ebola who had, again, sort of much like with the coronavirus at the moment, sort of symptoms and signs suggestive, but thankfully they always came back negative. And sometimes therefore were unexplained sort of other illnesses. While I was there, quite a lot of just kind of working on the medical wards. There's quite a lot of work with HIV, with TB, with sort of general bacterial infections, diarrhea, those types of things. And was there after there was a mudslide in Sierra Leone in, I think that was August 2017, and I was there shortly after that, and so did they did some sort of, they were worried that there might be a cholera outbreak at that time, and so I was working with the Ministry of Health and things, trying to sort of mitigate for that and set up rapid testing and things. And so that has been instructive for now. You sort of, a little bit of that has now fed into, obviously this is a much, much larger scale response, but you could kind of, some of the stuff that you learned there, you can see. And I know that in Sierra Leone, they are currently planning for coronavirus using sort of some of those same structures and things that were set up during Ebola and then sort of, again, strengthened with other things since. So I think so, some of the work we were doing was kind of health system strengthening, and I think hopefully that there is some lasting effect of that. It's difficult to tell when you're there. You often don't really feel like you're making much difference, but I think it's a sort of team effort, and hopefully you can be a small part of that team for a small amount of time.
Do you feel like you're making a difference right now?
Yeah, right now I think it's interesting. I think we've had incredible leadership in the hospital that I work in, and so you're sort of trying to follow the lead of those people, and then, as I say, be part of that kind of learning for the rest of the hospital. So trying to allay the fears of other people who haven't seen as many cases of you and that kind of thing. So yeah, I think definitely at the moment you can see that you can make a difference, and also just they need people on the ground. So you can be, again, it's being sort of one part of a very big picture. I think it's definitely, I'm glad that I'm here and able to be part of the effort. Yeah.
I think a lot of people might be struggling with where they are in their occupational lives right now. There's a lot of people getting laid off, a lot of people whose jobs might not be tied into the keeping the structure of society alive at this present moment. I guess I'm wondering what you might say, or what your perspective might be about how each of us can feel like important and like a part of keeping sense of community alive and keeping sense of faith alive and keeping a sense of identity too. Like that's really important right now, I think.
Mm-hmm. I think, as you said, you mentioned community, and I think that's one of the things that's kind of come out of this is that, I don't know what it's like in Canada, but certainly in the UK, I think communities have really rallied round. They've recognised that they will have more vulnerable members in them and less vulnerable members, and therefore trying to help those vulnerable people out so they don't need to go out to get the shopping because somebody else can do it for them and things. So I think it's been really amazing here. There was seeing the response of people sort of just taking up that burden without being asked necessarily, and so sort of setting up community groups and things. So that's been amazing, and I think that people, there's a lot more people working from home and things, and just everybody's sort of very understanding of that and of the need to still connect with people and the need to sort of be aware of people around you. I think one, in terms of faith and things, I think that one of the things that has been nice for me is sort of being able to reconnect with people, and like you get into your habit of going and seeing one particular group of people on a Sunday morning, and having sort of similar conversations each week. And actually now almost the fact that everybody's connected via Zoom and digitally means that you can expand your horizons a lot more, and so there's nothing that would stop me from joining a meeting in Scotland or even like a meeting in America this weekend if I want to. And so you can have fellowship with a lot more people. So I think kind of, suddenly in one way people are far less connected because they're not going out in their actual physical communities every day, but digitally everybody's a lot more connected suddenly, and it's kind of been an impetus to get in touch with people that you haven't been in touch with for ages and things. And so I think that that's one benefit that you could see as well, is sort of being able to get fellowship, cast the net wider and get fellowship from a sort of broader range of people.
Yeah, and I was going to ask you about connection in PPE. Like, you're layered up in a gown and a mask and goggles, maybe, I don't know, closer to some of the people who are sick than even their family members, with the exception of if things are going really bad, it sounds like in your hospital. Like, what is it like to be closer to somebody who's at a very vulnerable place in their life than any of their loved ones, wearing this gown and face mask and such? Like that sounds like a really powerful place to be, or a really poised place for connection, and like a really weird time in a really weird space.
Yeah, no, it definitely is. And you almost forget that you've got the, this thing that's hiding most of your face on, etc. Yeah, you do have to remind yourself that it can be scary when you're going into people's rooms sort of all gowned up and everything, and that's going to probably cause some anxiety on their behalf, and try and sort of get beyond that. We're making sure that we've got our name, either they've got these sort of magnetic badges that we can clean that have got our name on in big letters, or making sure you've got it stuck somewhere or written somewhere on your gown if you go in, so that people can still see who you are. But yeah, no, it's definitely difficult to overcome that barrier, and with your colleagues as well, because the fact that we're opening all these new wards, there's a lot of different nurses that I'm working with that I haven't met before, and you see them on the ward and you're interacting, but then you see them in the staff room and you kind of think, oh, is that the same person that I was chatting to? But you're not quite sure, because you haven't actually seen their full face before. So yeah, it can be it's sort of funny from that point of view, with regards to interactions. And definitely, I'm sure that, I think the patients, most of the patients that I was seeing last weekend, they were pretty used to it by now, and it's, most of them weren't that unwell. They were probably in hospital for other reasons, or by the time that I was seeing them, the coronavirus wasn't really a problem, but they needed to have some extra help at home or something like that, so they're having to wait in hospital a few days longer. But so there was a sort of sense of community on the ward as well, which I think there probably is in most hospital wards. They're sharing newspapers and that kind of thing, and having chats amongst themselves, because they don't have to wear the masks, so it's sort of, they're sort of free to interact with the other people in the bay and things. So not everybody's sort of tucked away in side rooms. We've got that, we've had to open the sort of cohort wards for positive patients now, and so at least there's a bit of a sense in those wards that they're all in it together, I think.
That's really interesting. That's an interesting perspective to hear, because you see all these news clippings of people in toe-to-head PPE suits, like on the streets or in the hospitals, and it just comes across as really abrasive and like foreign and like othering. Like there's this otheringness to it, like this like full body barrier between you and I. And so it's really interesting to hear you say like that you forget that that's even there, and the connection is still very real for you.
Yeah, well, we're not wearing the full suits and things, so our PPE is a mask, a visor if we need it, if we're doing something that might make splashes or generating aerosols, and then otherwise we've just got like a plastic apron and some gloves. So scrubs and things underneath. So you can it's not the whole kind of like hazmat suit that people see in the media. So yeah, so it's not that. I think you definitely would be aware that you got it on, because they're really, really hot and they make you really sweaty, and there's only so long you can sort of tolerate being in a ward with those on. So I think you'd definitely be a lot more aware if you're wearing one of those.
How has all of this affected your relationship with God and Jesus?
I'd say maybe it's brought me a bit closer to them again, because there's a lot more unknown in my life right now, so I'm having to rely on them a lot more. And as I say, has like sort of, yeah, I guess I'd maybe before this happened had sort of drifted slightly, partly because of having a young child, so I found it difficult to engage with the, going to church and things like that. You get there late, you don't sort of fully engage with listening to the talk and that kind of thing. So I guess it's definitely helped to ground me again from that point of view, and sort of focus on what really matters. I think that you realise it is a sort of good reminder again that we need Jesus to return. That's pretty much the only thing that's going to sort the world out. So when you see this sort of the world just careering towards disaster, it's hard not to for that to sort of come to the forefront of your mind again, I guess. And so you're sort of praying for Jesus' return, because we've got some solutions, but we definitely don't have all the solutions, and it's definitely going to be a lot of suffering for a lot of people. So you sort of try to do your best to alleviate that, but you know that ultimately there's a limit to what man can do. And so, so I guess that's one of the other sort of things that I've been thinking about quite a bit.
And like beyond the greater Jesus returning piece, which is very important to keep in focus, do you find yourself in a hopeful place, or could you offer? Yeah, I guess it's just a question about hope. Like, how do you use the term the earth is being hurled towards destruction, like, and so while we might feel like we're on this spinning, hurling void, like heading into nothingness, like what message of hope do you have, being somebody who is at the very heartbeat of this thing?
I mean, I think I can't remember who has said it, but I've definitely heard experts say every pandemic has a beginning and a middle and an end. So while it doesn't feel like it at the moment, there will be an end at some point, but it's just weathering that storm in the middle, and we don't know what that's going to be. And it's going to be different in every country. People keep talking about reasonable worst case scenarios, and they sound pretty bad. I think that's why the government at the moment have put these restrictions in place to try and, everyone keeps talking about flattening the curve so that you can sort of spread the amount of infections out over a long enough time period that the emergency services can cope in the meantime. So definitely at the moment there's a lot of unknowns, and it's hard to be completely reassuring to people to say it's going to be fine, because I don't think anybody knows that. And and the other thing with public health, as everyone says, is that if you're right and what you do works, then whatever you did looks like an overreaction. Because if you say, right, you've got to go on lockdown, no one can go out, and then nothing happens, everyone's like, well, we didn't need to do that then, did we? But actually it's because your intervention worked. So at least hopefully maybe in a few weeks' time, this will all look like an overreaction, but it's hard to think that that's going to be the case at the moment. So I think, at the moment there's a lot of unknowns, but there will be a big beginning, a middle, and an end. So I think that would be the thing to bear in mind, really, in terms of hope.
When all this passes, when this does end, what will you do differently in your life, or what changes will you make to your life?
I'll appreciate at the moment I would say I'd appreciate being able to go outdoors. Like, I guess you'll appreciate like the human interaction a lot more. But all these things will fade, I'm sure, as you get back to your normal routine and things. But I think that maybe hopefully that sense of community will persist, and you'll know your neighbours better than you did before. I guess in terms of differences, then maybe it'd be kind of trying to look out for people around you a bit more, and you kind of hope that in wider society that might be a little bit of a shift that people would make, and realising that again, I've heard people sort of say that, like in the last few years, that the world has kind of split up into separate factions, and it's kind of like every country is just looking for its own interests, and then something like this comes along and you realise how connected the world is. And so sort of people having to, the world is undeniably connected, so rather than trying to fight it and be kind of nationalistic, then how are you going to work sort of for a sort of more open an inclusive world, I guess. So hopefully you can see how different countries can work together, and hopefully there would be some benefit that would be lasting from that. I mean, I'm not saying that's going to affect me on a personal level, but you would hope that sort of on a wider level that would be something that might persist and be a positive outcome of it.
Yeah, it's interesting that you've been involved in so many different system health initiatives in Africa, in England, your current job, and how your answer to that question was very like system level, like like your brain's just on that platform of like, how do we make this a better place right now? And I think that's very, at least that's very counter to my brain right now. Like my brain is the opposite, very like personal, individual. I'm just like sorting through a backlog of things that I needed to work through in my head and in my life, and my orbit is very small, in about 300 square feet. And then if I ever go for a walk, it's a little longer than that. So the world right now feels like a really like confined space with a lot of borders for me. And I think the vision that you painted about an inclusive and a more connected community is very appealing. So that's something that I'm going to cling on to from this conversation for sure. I'm sort of out of questions. You just like you blitzed through everything that I wanted. I guess I'll just ask, is there anything that stands out as particularly meaningful to you from this conversation?
I guess as I say, I've been quite embedded in it since I went back to work. And so I don't really have an appreciation for how people feel outside the bubble. So it's definitely been good for me to hear your side of things as well, and just, things like that fear that people have, because I know I can kind of rationalise that fear quite easily because I know what I see at work, and it's not that I don't have it deep down as well, or like a little bit every so often, but then you can easily sort of make it go away again. But I think if you don't have those other things to anchor, then maybe it's harder. So I think definitely sort of having an appreciation for people who are outside the bubble at the moment, and actually almost like it's quite a privilege. I think, again, I saw one of my colleagues on Twitter, he's doing a night shift, which, I mean, when I do night shifts, I'm not going to have done one for 10 years, so it's not something I'm really looking forward to. But he's saying that at least we get to go to work and we're having that social interaction every day with our colleagues, with patients, which a lot of people don't have at the moment. So I'm sort of realising that I am actually somewhat counterintuitively in quite a fortunate place, because I'm still able to go about pretty much what is my normal life, when everybody else's normal lives have ground to a halt. So I think definitely that's what I'll take away from this.
One more question popped in my head as you were talking. So you were talking about, a lot of people have a sense of fear right now, and even you somewhere deep down have a sense of fear about what's happening. And then you said that we could rationalize that away. Is faith a part of that rationalization? Or if it's not, how could it be? Is that rationalization like the thing that snuffs the fear out? Is that, your experience working in Africa and working in your hospital now? Or is faith woven into that overcoming of the fear at all?
It's probably woven in, but I would say that each fear is its own thing, and then I'll kind of, so say my fear is, what if I get the coronavirus, and what if I get really sick and die? But I will just sort of say, well, actually, look, the overall mortality rate is probably close to 0.51% or something like that. There's no reason that it would be you, and therefore, that's probably an overall mortality rate, in your age group is probably younger. So I guess more it's like on each individual fear, it's like a kind of talk yourself back down again. You can sort of talk yourself up quite quickly, and then sort of bring yourself back down. But I would say then on a different level, you kind of go, well, what if I did die? And it'd be like, well, then that would be what God wanted for you. So it is, the faith does come into it, but it's on a sort of slightly different plane, I guess. Everybody's got to die sometime, and so if this was it, then it wouldn't be what you'd hoped for necessarily, but it would be what it would be, I guess. And well, you don't know what would happen afterwards, I guess, but you hope that the people would be able to draw on their faith as well to find strength if that happened. But I think that you don't dwell on it too much, because otherwise what's the point? But I mean, you could, I equally, when I get on my bike, have that same level of like, but what if this time you go onto a lorry? So it's not just about coronavirus, I guess it's everything really, and it can happen. That people die in London on their bikes every year, and so it's sort of everything has an inherent risk in it.
Yeah, I think this pandemic just kind of like wakes up that like really hard existential question for people, and makes it like, feel closer to us than it might normally feel. But I think that's a really beautiful place to leave it, is that, you can have individual ways of rationalizing through a lot of fear that's happening. But at the end of the day, underneath it all, there's this kind of current of faith that holds that. And that's at least in my head, what I was thinking of when you were talking, is that, the thing that just holds it up and holds the thought and holds that emotion is, fear at its roots. And maybe that's what you, not what you meant,
Yeah.
but that's what was coming to mind as you were talking.
Yeah, no, I think that captures it, yeah.
Thank you. I don't have any more questions for you. This has been lovely.
Okay, well, thank you very much for talking. I hope it's been useful. It's been great talking to you.
Hello, this is Tom from the Platform, a Christadelphian podcast that tackles challenging topics and how we talk about them. Our aim is to bring self-awareness to the debate in the Christadelphian community and instill good conversation through listening techniques. You can find us on all good podcasting platforms, and we are proudly supported by the WCF. We look forward to you joining the conversation. If you have any comments or questions, you can find us on Twitter and Facebook.